Hi, I'm Dr. Don Funk from House Call Chiropractic. My friends call me Dr. Don. I'm going to spend the next 5–10 minutes explaining the tennis ball massage to you. I've used this with dozens of patients over the years, and it's made a huge difference in the amount of low back and leg pain that they experience. It's also worked for me. I can relate. I've had a couple years of low back pain myself, and it works wonders. So let's not waste a lot of time. Let's get started. The 10-minute tennis ball massage is exactly that. You need to spend 10 minutes a day at it. The best time to spend 10 minutes a day doing tennis ball massage is right before bed. Before you climb into bed, just get down on the floor, do the massage. You'll sleep so much better. I guarantee it. That pain that wakes you up in the middle of the night, that makes you toss and turn and lose sleep, hopefully that will go away over the next few weeks for you. And as we do this, we're going to find the tender points and then linger over those tender points until the pain diminishes. We don't want to just go over them and feel that, ouch, that's tender, and then move on to the next area. Just linger on that for about 30 seconds until that pain slowly subsides. We're going to start with the tennis ball, but of course, as that becomes easy over a few weeks, we're going to move on to a lacrosse ball. And for some of you, on some areas, a softball may work best. We're going to talk about fascia here because this fascia is this white stuff that covers the entire body. It's said that if you dissolved everything but the fascia in your body, you would still be completely recognizable. There's that much of it. It goes around the outside of your body, around the muscles, around your organs, even up around your brain. So as you're loosening up this fascia down here, in your gluteals, in your buttocks, you may feel relief up here in your upper back. It's very thick and strong. When I was in school, we thought this was just dead connective tissue that just held everything together. Well, now we know that there's 3 different kinds of nerves that come from this fascia and go to the brain and tell the brain things about what's happening in that fascia. Is it being stretched? Is it damaged? Is it torn? And as it's damaged, the brain says, we better not move that area. Well, we need to fix that. We need to get in there and heal that fascia by doing this deep tissue massage with the tennis ball, because that fascia can limit motion. And as the motion limits, range of motion suffers, weakness begins, and then injuries tend to happen. And stretch in one area may cause pain in a distant area. So if we're working on these gluteals down here, we're stretching all the way up here into this shoulder. So you may get relief from a shoulder problem by working down here in the gluteals. Let's get started. We're going to start with the hip flexors. Hip flexors frequently cause pain down into the legs or into the low back because as they pull, they'll twist that pelvis, because usually you'll find that you're tender on one side but not so much the other. And that'll cause a twisting in the pelvis, which causes an increase in the lumbar curve, which then leads to more low back pain. Those joints get jammed together in the low back. So the way we work on that is we lie on the floor face down. We have weight on our elbow, our hands, our knees, and then we're going to rest our watch pocket, that watch pocket that's on your blue jeans. We're going to rest that right on the tennis ball. And we're going to move it around a little bit. This is a pretty small muscle, but it causes a lot of pain and discomfort. And again, you'll probably notice it more tight, more sore on one side than the other. The next muscle we're going to work on is the deep muscles of the hip. Here's the gluteus maximus here, this big, thick muscle that when you pat yourself on the rump, this is the muscle you're feeling. But under that are all these muscles. And here's your pelvis here, and then here's your leg bone or your femur out here. They connect. And if these muscles are tight, then that leg doesn't work properly, and then that transmits more tearing forces up into this lower back. So we need to loosen these muscles up. The best way to do that is sitting on the ground. We have our weight on our hands and on our legs, and we're going to lift up, slide the ball under our buttock, one side, and then we're going to roll on that. And we're going to find the tender area, linger there, and move on to the next one. And I guarantee you that we're going to find more tender areas, because there's often a problem up in this muscle, then one in this muscle, then down here in this muscle, and then over here. So it's important to spend quite a bit of time on the buttocks. There's a lot of muscle there. The tensor fasciae lata is this muscle, or TFL, that runs down the leg. It's like a broad band here and comes down around this leg. And it can be exquisitely tender for a lot of people, so be careful with this one. This muscle keeps the leg from rolling in, twisting inward as we walk. And because we sit so much, many people have this muscle that's overstretched. To take care of that, we're going to sit on the ground with our feet to the side. We're going to have our weight on our hand and our buttock here. Then we're going to lift this knee, slide the ball under, and then we're going to use this hand to push down on the knee to put a little more pressure on that ball. Move up and down this leg and go slowly. Chances are that you'll find many spots along this muscle and band that are very tender. I love the lower leg and calf muscles. The lower leg and calf muscles. You can see the muscles in here. This is kind of like the drumstick. And on a drumstick, there's not a lot of muscle, but there's a lot of tendons and ligaments. And we need to work on that fascia and those tendons and ligaments, because all our weight is on these feet, and these muscles and tendons work tremendously hard. When you're doing the tennis ball massage on these muscles, oftentimes you'll have get a sensation in your upper back, because again, that fascia is connected all the way through the body. Sit on the floor and then just roll that ball back and forth until you find a tender area. Linger on that area for about 30 seconds until the pain subsides, then move on to the next area. The adductor muscles are exciting because there's so many of them and they're so long. These up here are pretty hard to get to, but a lot of people have tenderness right in here. So we're going to sit on the ground and then use that ball right along that muscle, and you'll find sore spots. Again, spend about 30 seconds there, then move on to the next one. So as you move along, you may find that it still hurts. Well, spend a couple of weeks doing this. If it doesn't get better, then seek help. Get in touch with me. I'm email away. I'd love to help you out. If you're in another state, maybe even if you're in another country, I'll help you find a doctor that can help you in those areas. In the future, I'm going to be making some videos along the same lines for working on upper back and neck pain discomfort, so stay tuned. I'll probably be sending you some emails that have different tips in there for dealing with your low back pain. So until next time, be well.